5 minutes of questions, and looks like you will be the last questioner, and we can wrap up.
Madam Chairman, it seems like you and I share a theme that just as you want to go vote, it's my turn
I know.
to ask questions. So I appreciate a few minutes and our witnesses this morning. You know, this morning I mentioned that I'm in a unique situation. I've not been on the committee as we've done this process before, and I don't have a healthcare background. But I also believe that lets me see a little bit of the forest, the trees in the forest from a distance and a different perspective, and bring kind of a problem-solving business mentality to this as well. This morning, I also shared a story about a Utah, a woman who has a son. He's 5 years old. He has classic galactosemia, and this mother is desperate for access to AT007, a central nervous system penetrant inhibitor used to treat this disease. This drug could change her son's educational trajectory at a time when his mind is developing very quickly and in a unique period in his life where it will make a difference to help him be a self-sufficient adult. I know that this panel may not be able to speak to the specific drug, but I've heard multiple stories about Americans and Utahns like this that I referenced this morning, and who are desperate for access to these innovative therapies. Dr. Vera Shogam and Dr. Gon, or Mr. Gon, how would these agreements being considered before us today help accelerate the approval process for these medical products and give these people hope? Doctor, we'll start with you, please.
This is an ultimate goal of both PDUFA and BZUFA programs to make sure that the drug development process is efficient as possible and that FDA's review as expeditious as possible and the system in place is predictable for sponsors and for patients, because they can be sure that the process is moving in a timely manner, and they will have access to life-saving medications as soon as FDA can make that benefit risk determination.
Thank you. Mr. Goya.
Thank you for the question. So as we talked earlier, Mr. Carter asked that question about getting generics to market, and of course the innovator has to come to market first, and then we have to get through all the patents and the patent tickets to happen with those products. Once that happens, we have now built into GDUFA 3, specifically product you're talking about in complex generics that would allow it to move through that process more quickly.
Thank you. I mentioned this morning, it's my hope we can put names and faces behind these people, and that might help us motivate to go quicker. We had a biomedical innovation hearing in December in this very room right here, and I shared